Multiple sclerosis is a debilitating disease. Its cause is unknown and there is no cure. While research on the disease is constantly progressing, for many people living with MS, that research is just not moving fast enough. Now, hundreds of Australians are going overseas every year in search of treatments not available here yet. Leah McLennan reports on a South Australian woman who's about to embark on such a journey.
Used to be a rabbit and a fly on his nose. So he flicked it and he flopped it and it flew away.
Sarah and Tom Tilbury and their son Oliver look like a normal, happy, healthy young family. But before Oliver was born, Sarah started falling over.
Not just like someone who's a bit clumsy. My whole right side would get weak and I'd, without warning, be on the ground. I also had what's called optic neuritis, which is swelling of the optic nerve. So I started getting double vision when I was just walking around or driving or at the supermarket, which was quite alarming. And I had periods of time where I had, complete vision loss.
It was when she was in hospital after giving birth to Oliver early this year that Sarah was diagnosed with multiple sclerosis. She was told as an otherwise healthy 26-year-old woman she was unlikely to experience a rapid onset of symptoms, but she's had 2 relapses in the past 9 months.
I ended up really not being able to walk without assistance. Tom would pretty much have to hold me up and I was dragging my leg a lot of the time. I knew I wasn't okay, so I actually went and got myself an MRI. That MRI indicated that I had enhancing lesions and that my lesions were quite numbered, and in particular I had lesions on my spine.
The relapses meant Sarah could no longer live in the 2-storey house the couple had just finished building near Robe in the state's southeast. It also meant she started looking for other treatment options.
Coming up.
It's a scary thing to do.
Doctors blast Christy with chemo.
Sarah Tilbury came across a television report about Christy Cruz, a woman with MS who'd travelled to Russia for a treatment called an autologous hematopoietic stem cell transplant, or HSCT.
I decided to sit down with Tom after a bad day I'd had and watch the 60-minute show. So I found it incredibly confronting to watch, probably mainly because I think the thing I said to Tom was, it's just like me. Like, me on a bad day was what they were showing, and that is incredibly confronting because I think still I was in a bit of denial.
Like Sarah, Christy Cruz was a young mum living with multiple sclerosis. After seeing the report, Sarah got in touch with Christy and began researching more about HSCT.
Such a shock how quickly things have changed and, we have such big plans.
Before the treatment, Christy Cruz was fatigued and needed a walker or a wheelchair to get around. Now, more than a year after the treatment, she doesn't feel like she has MS anymore.
Physically, I'm back to how I was 10 years ago. I feel great, I've got lots of energy. I'm travelling around the country speaking to people. I can make plans 5-10 years from now with my children, and I don't nap anymore. I'm not on any medications and I feel really fit and healthy.
Without any options for her for HSCT treatment in Australia, Sarah Tilbury decided to try Chicago. It's there that American Dr. Richard Burt pioneered the treatment for MS and other autoimmune diseases.
So I've seen now in my life that we've taken an adult stem cell, an immune stem cell, and we've made a whole change in these autoimmune disorders. Disorders that previously didn't even have a definition for cure.
All right, let's go.
Treatment in the US doesn't come cheap. Sarah's medical bill alone will be $140,000. And there's the emotional cost of Sarah and Tom leaving baby Oliver behind with his grandparents for 2 months. But for the Tilburys, the sacrifice will be worth it if Sarah can come back and be a healthy, able-bodied mother.
Our whole life has been thrown upside down by this disease, and quality of life is huge. So if I come back and I've had my disease halted, which it has been proven to do, I'll be ecstatic. Anything on top of that is literally like icing on the cake for me. I do have certain, goals ahead of me, and one of those is walking down the beach with Oliver when he can start walking. That's a big one for me.
This is one of our stem cell patients.
Dr Colin Andrews is a Canberra-based doctor who has performed HSCT on MS patients in the past. The procedure involves harvesting stem cells from the patients and giving them doses of chemotherapy before replacing the stem cells in the patient's body.
MS is thought to be largely an autoimmune disease, mainly involving T cells. So what we do is we harvest cells and treat them, and then knock out the marrow and knock out the T cells in the brain, which are producing the disease, and then the patient reboots their immune system with the implanted cells. So it's as though they get a whole new immune system without the offending T cells.
HSCT has a 1% mortality rate, and Dr Andrews no longer provides the treatment because Canberra Hospital deems it as high risk. The only place in Australia where it's now available is at St Vincent's Hospital in Sydney, where doctors are conducting a small-scale clinical trial. Professor Trevor Kilpatrick is a neurologist and one of Australia's leading experts in treating MS. He says HSCT appears to be effective in certain circumstances, but there's not yet definitive evidence.
Hematopoietic stem cell transplantation has a defined mortality, and unfortunately between 1 to 2% of people, that is 1 to 2 out of every 100 people who undertake this intervention, will unfortunately die.
This is a very serious procedure. You're doing it because you're fighting for your life and you want to have quality of life free of MS.
Sarah Tilbury isn't the only person with MS to contact Christy Cruz about HSCT treatment. After her appearance on television, she has been inundated with people wanting to know more. She now travels the country, addressing forums of people with MS and their families.
I feel for the people with MS who haven't heard of this treatment. So what I'm motivated to do is just to let people know that this is an option for them so they can make their own informed decision.
Professor Kilpatrick says that progress in MS treatment means there's other options before people should consider HSCT. He says Dr Richard Burt in Chicago is now testing those treatments against the procedure he's pioneered.
He's instigated a clinical trial in which there will be randomisation for patients between standard therapy and hematopoietic stem cell therapy to understand who fares better, whether they're equivalent or whether there are significant problems with one approach as opposed to the other.
Sarah Tilbury says she can't wait for those trials to be completed while her MS worsens. She says the risks in getting the treatment are nothing compared to what is motivating her to do it.
Obviously my biggest concern is leaving Oliver. Yeah, I don't want to leave him. Right now I am struggling to leave him. That's my biggest concern. The treatment is nowhere near as scary as me flying to the other side of the world without my son. So that would be my answer to that, and I think that really tells you why I'm doing it, doesn't it?